Hello and welcome to Focus on Liberia. Welcome to yet another special broadcast here at Focus on Liberia. I am Anthony here, co-hosting with my partner Dennis Jar. And in today's edition of our broadcast, we have with us as guest Dr. Dougbeh, an acclaimed Liberian medical scientist. He is our guest. And those of you who might be wondering why we got Dr. Nyan in the hot seat, we have something that is been talked about in the world today. It's somewhere he has an enormous expertise. And so we reach out to him and he has agreed because he has been sounding this, wondering about this crisis. So he is here and here are the segment that we will be discussing with Dr. Nyan in this exclusive interview. Number one, we want to know, Dr. Dougbeh letter to President Weah and the Senate. He put a letter first to the Senate on a subject talking about COVID-19, and then a letter to the president. What is going on? What is he trying to do here? Want to get into his head. Also, we want to talk about vaccinating Liberia. The Liberian government COVID-19 vaccination program. Where is it? Is it organized? Let's hear from the expert, the guy, he knows this thing. So we are here with him. And finally, Dr. Nyan's works as an activist, a politician, and a scientist around the world. I am excited about this. Hey, guess who is also excited? A partner, Dennis Jar. I'm ready. Let's do this.
We want to welcome all viewers from across the globe. And Dr. Nyan, welcome to Focus on Liberia. We want to also welcome our colleagues there at Truth FM. Welcome. We're very glad to have you, Doc.
Thank you very much for the invitation.
All right, Dr. Nyan, again, we want to say thank you for honoring our invitation here at Focus on Liberia. Those who are joining us, we want you to do us that usual favor by sharing the show with your contacts. One of our kind is here to talk to us on a very serious subject. News filtering in from Liberia is that this thing is getting serious. He sounded this warning before, but he's here with two hats. I'm not going to leave that side out. That's the side that I like. Hey, we have with us a gentleman by the name representing Truth FM. They are simulcasting this broadcast. Welcome to the show. Dennis, let's get started.
We want to welcome all viewers again. Dr. Nyan, we're glad to have you. You've been here before, so we're glad to have you. How is we getting news that COVID-19, there's a new variant in Liberia and there are some deaths. I'm not sure if those are COVID related. But from what you know, how is any update on COVID-19 in Liberia?
Well, COVID-19 in Liberia, as we have been receiving as news and been following the developments there in the pandemic response, is spiraling out of control.
Go ahead, Dr. Nyan.
Yeah, the situation of the COVID-19 pandemic is spiraling out of control in Liberia. There have been several reported cases of infections. On one occasion, it was reported that, in fact, up to now, we may have more than 50 to 75 infections at any one point in time. We are very concerned because this particular surge, which is now described as the third wave, was predicted, and the authorities were warned about this. It is quite striking why there was no action taken, and that it seems that health authorities and the government was pretty much relaxed, as was seen with the exemplification of relaxed situations at the airport. Pandemic regulations at the airport were pretty much not in order, and that is the first place of entry in a country where the regulations are first and foremost enforced. And given they travel between Liberia and Asia, particularly Southeast Asia, India to be specific, and of course China, with the upsurge of cases in China and excuse me, the cases in India, during my visit to Liberia and Prara, I have warned about a possible transmission of the variants in Liberia. And during my visit there, on all of the public awareness exercises that I conducted, including one at Truth FM, this particular warning was sounded that we are not out of the woods, and there was something disastrous coming. We discussed those variants specifically because the journalists were really interested in knowing what that was. In fact, one of the journalists joked me about having a double max, and I said that's one of the reasons why we, in the United States and other places, if we talk about wearing double max, and that is why you saw it like that. That's the present situation in Liberia.
And from your experience, what is the government response? What has it been, and what's your level of satisfaction with that?
Proclaiming and regurgitating these public health responses that have been put in place globally in a country, like wearing of masks, keeping distances, reducing the quota of people in the markets, in the schools, in the churches, etc., can be sounded, which has been sounded by the government of Liberia recently through the Ministry of Health. But my question is, and our concern is with the implementation stage and the strategy in implementing that. Those two important aspects are lacking. There is not the actual strategy as to how these regulations are implemented, and there is not the enforcement aspect of the implementation.
And Mr. Sia, before you come in, the question now will be, based on your expertise and your knowledge and skill, what are you doing about this? Or what has been your own involvement?
Well, I went into the country from the time of the outbreak of the COVID-2, which is the SARS-CoV-2 virus, and of course the disease causes, which is the COVID-19. I first sounded the warning as far back as January 2019 to alert the African continent through our group, the Diaspora COVID Focus Group, Expert Focus Group, alerted the African countries, and specific communications, as you probably saw, were sent to these governments. That was the first thing. The next thing was when they woke up finally, it was a little late, just as Europe woke up late and America woke up late. So it was not unique to the African continent. It was also not really unique to Liberia. But what happened is, in knowing what this virus was, one had to diagnose it, one had to carry out detection and diagnostic exercises. Liberia did not have, and presently does not have, the capability to mount a robust diagnostic testing for COVID-19, yet let alone other infectious prevalent diseases. The U.S. Center for Disease Control sent out in early January, the end of 2018, early 2019 January, sent out testing kits. And these testing kits were proven to be faulty and were giving out false results. The Liberian government had the testing kits. The NPHL were using this testing kit. Our second involvement again was to alert the African government specifically and to alert Liberia, Ghana, and other countries that these testing kits were faulty and they would mislead them. And so they should not use them. That put me in conflict. Instead of receiving this news with open arms, that put me in conflict with the government and the National Public Health Response Team. Only to prove later on that I was correct. then I asked the Liberian government whether they needed my services, and I offer it. Not just me, but the services of other diaspora Liberians who are professionals in mounting infectious disease pandemic or epidemic response. Wrote the government directly and offered to develop Liberia's testing kits. The government did not respond to that. They actually rejected it and waged a war against me, which was not hidden. They even tried to mobilize the WHO representative in Liberia against me, that which also failed. And I made another overture and consistently, uh, provided suggestions. I called for a lockdown. The government initially refused, but later locked down. I called for isolation centers to be built outside of Monrovia when the government then intended to use Redemption Hospital as their isolation center. And I said, COVID-19 is different from Ebola. So you have to build your isolation center outside of the populated areas. I remember the representative of the Newtown borough and that district also sounded the same warning after I sounded that. And that prevented them from building it in there. But if you can see, these are the tussles that I had. At every stage, I, along with other colleagues, have provided the necessary and requisite public health pandemic response advice. The last thing, which is the latest, not the last, was I also indicated during this time of COVID-19 vaccination rollout globally, I am coming to the West African region and will be in Ghana. That was in April this year. I wrote the government that I am coming. I am willing to come in so that we can begin the vaccination exercise to carry out awareness first and foremost. Because if the people are not aware of what they're going to receive, you're going to have problems since there's a whole lot of conspiracy theories around the vaccines. So you need professionals to provide awareness and then to lay out a clear-cut roadmap as to how these vaccines will be administered. You will note that our vaccines were donated by Gavi, and our government didn't pay a penny for those vaccines. So there are time duration in terms of the viability, expiration dates. If you don't begin to give the vaccines immediately in order to reach the quota or to exhaust the quota that you are given by Gavi, you would have had the vaccines expiring. And that will mean you are wasting other people's taxpayers' money, and your population is left unvaccinated, and you stand the risk of being, of the infection spreading. So that's where we are. I went into the country and they refused me, but I carried out some of the work I needed to carry out, and I came back.
All right. Thank you, Dr. Nyan, for giving a comprehensive outlook of the activities that you been carrying on in your way of helping to fight this killer disease. And talking about that, I understand one of your recent trips, you carry on sensitization, you met with people. I have a clip here that I'm going to play for a few seconds, and then we will come back to you. So let's do that.
Next, what is the importance of the vaccine? And many people ask the question, why should I take the vaccine? And even nothing wrong with me, why should I take the vaccine? Yes, that's the very reason why you should take the vaccine, because nothing is wrong with you, you're not sick. The vaccine is meant to prevent, just in case you have this COVID coming to you. Now people say, well, you like Liberia, we didn't get much of that, yes, but now you saw the variants that we talked about. There are no variants circulating. You don't know how virulent they are, how strong they are than the first one. That's the reason why you have to take the vaccine. Another reason why you have to take the vaccine is, you look at India today. Now, we're not being pinpointing people, okay? We're not pinpointing, but you see the wave of cases that are going on. You remember I said in India they had the double mutant? Mm-hmm. So can you imagine, India had a good slope coming down, the epic curve. Now, look at what is happening there. Just before the vaccines were start being made available, they had this wave, this spike, and they have a second wave now. And you see how much people are dying. So we have trade connection, long-standing roots, with India. We have our Indian brothers and sisters coming to us. We go there. Our Chinese brothers go all in the places. They come to us. We go there. We all interact with each other in trade and other things. So, and that's how the diseases travel also. So with the population that are coming here, or you go there, they are.
So, Dr. Yan, that was you that sounding the warning, talking about India. So you were there helping. You were providing sensitization, right? And so then the question comes to mind. You as a Liberian, maybe in partnership with other Liberian groups, can go to Liberia and do whatever you can. But you saw the need to ask the government for permission. Why was that important in the first place? Because you talk about your letters and we're going to get to them. I just want to know, why was it important that you sent a letter first to the Senate and then later to the president about how you want to head?
Well, that's the authority of government that we have in our country. It is all, require of all of us to respect the authorities we have. And that's what I have always done. No matter how critical I am, but I am respectful of the existing authorities. And the most appropriate administrative diplomatic way was to officially inform the government first of the first letter you are talking about, which went to the Senate, to catalog the weaknesses in the system. Remember that letter was sent in September 2020. Right. So the whole of 2019 and 2020, everything that I had enumerated earlier being of problem between the functionaries of the pandemic response and myself, all of those were cataloged. And I asked the government to review those so that we can start at fresh. Since that was not done, that is a question for the President pro tempore and the Ministry of Health to answer if you ever get them on any of your shows. The second thing, at that time I was calling for a hearing.
Okay, yeah. Before you continue, when you say you asked the government, who is the government? Who specifically did you ask?
Most of my communications in the earlier stages went to the Ministry of Health and the National Public Health Institute. So you know who the minister is, and you know who the National Public Health Institute director was at the time. In terms of functionaries, those are the branches of government dealing with the situation that I directly contacted. Then next was to contact the Senate to have a hearing, because as you all know,
and Dr. Yal, let me hold you there before we get to the Senate letter that we have in our possession as well. What did the officials at the Ministry of Health and MPhil tell you for which you could not help? What stopped you? What did they say to you?
They never responded in accepting my offer, and they never responded to the affirmative. I think I will just shortly, summarize it in that form.
What was the medium of communication, and how sure that they got your communication?
Because I received feedback from them, from the very people acknowledging receipt of the communications.
And what specific help were you offering?
One, to develop Liberia's diagnostic testing kits for COVID-19 and Ebola and malaria and typhoid based on my technology. As you know, other countries were developing their own kits. The United States gave millions of dollars to companies to develop her kits. Germany did the same thing. Senegal, let's leave the West Africa. Let's come right back in the region. Senegal.
Did you need money from the government or just permission? Do you have this thing I don't want to look at it in a simplistic way, but let's say you
Right.
have all the materials to develop this kit. All you needed to say yes or no, is that what you wanted, or you wanted money?
The government provides the resources. The scientists don't have the financial and other resources to do that. The scientists have the knowledge all over the world. Even the companies that have money that are traded on Wall Street were given the resources to carry out what the government needed. For example, even the vaccines that were developed, Pfizer is not a poor country, a poor company. Moderna is not a poor company. Yet you saw the money that was given to them and the resources that were given to them. It's not their personal money they used to develop the vaccines.
Yeah.
After developing that, the government also went back to them and bought the vaccines from them. So what is being done is not magical. It's just the procedure. What
Right.
needs to be done. That
So-
pretty much that's it.
So the
All the scientists around the world and in other places are provided laboratory spaces. They are provided the requisite resources to buy the reagents, the chemicals, and everything that they need. They are
Right.
provided the resources to mobilize other scientists and then do the work that has to be done in the country. So those were the things that were needed. And,
Right.
and
So
the
Dr.
permission has to come from the government. You can't just do that on your own.
Dr. Yan, did you specifically list those things that this is what I need? Or was the letter just vague, saying, hey, I want to develop a testing kit? I mean, maybe someone who has no idea may not understand what exactly you were looking for. Did you specifically spell out what you wanted?
The authorities, the communication went to know exactly what was needed. Those letters do not have to atomize. The first stage is to say, this is what we have, this is what we want to do. The next stage is for those who've been offered to accept and say, yes, come, or no, we don't want that. If you accept, then you ask, what do we need to do? What is required?
Dr. Yan, were you giving a definite answer like, no, we don't want to do business with you, we don't need your offer, we don't need your help? How was the answer communicated with to you for which you came to the realization that, okay, I think they don't need me, I'm moving on?
The responses that came in were mixed. One of the responses, and I would say, was that I should donate the testing kits. So here you are talking about building the testing kits for the country, and they are requesting you to donate the testing kits. So this is where the problem came in, that our country is very much ingrained in this donation and begging syndrome. That with all the capabilities that we have, human resources, with all the financial resources we have, we still think that we should be dependent on other countries. Equally so, we should be begging and solicit donations, even from scientists who are asking you to provide resources for them to build your own capacity.
So, Dr. Yan,
that's one instance. Excuse me, that's one
Go ahead.
instance.
Go ahead.
The next instance was repelling very shrewdly the suggestions that were being made. First, about the outbreak. Two, about the location of an isolation center. Three, about the faulty testing kits. All of these rejections all play into not wanting you to come in to do what you offer to do.
All right. So, Dr. Yan, after you got that clear-cut understanding that they were not willing to work with you or to allow you to give the help to the government, instead they wanted you to donate it, how long did it take before you send a letter to the Senate?
Well, you will note that we went back and forth for some time.
Okay.
For those of you who followed this particular process, there was another instance where, when we talk about contact tracing,
I remember that.
instead of using the 2,000 plus contact tracers that we had trained in conjunction with the US CDC, the Center for Disease Control, I always make that clear, and other agencies that were available so as to mount, help to mount pandemic response, they left that and decided to train 6,000, quote unquote, 6,000 contact tracers through the Monrovia City Corporation. That was unscientific. That was liable to corruption because resources would have been transferred from the actual pandemic response towards MCC. And so that's one area where they came against me again. And when all of this happened,
well, Dr. Yan, what do you mean they came against you? You were the first to criticize what you describe as something not scientific. And I understand because you're speaking from the professional background and you wanted them to have gone to the people that were trained already for Ebola to have done the work. And you think you communicated in a more professional way than you should have. Somebody might think you did not because you went public. You didn't take the phone call to say, hey, this is the way to do it. We have people already, but you criticize the entire process. I'm not saying you are wrong for doing so, but that's why you did. Maybe that's why the bar blood started.
Well, from the analysis I have given up to that point, you will know that it did not start from that point.
Okay.
That was a reaction to previous communications that I had written, looking at the situation in the country, the pandemic response, and advancing the necessary and requisite professional suggestions as to how to move the process forward to respond appropriately. Because we are the same one carrying out the response in the various countries as well. So what we see and what we have as experiences, we want to translate that to our specific countries.
Dr. Yan, were you doing this as an individual? We always talk about institutions, right? Were you doing this, were you making these demands as an individual or as a group? Because in America here, we have the Liberia Medical Association. During Ebola, you headed the Diaspora Liberian Emergency Response Task Force. Now you have a diaspora focus group on coronavirus outbreak. But all we see is Dr. Dougbeh Christian. Who else is with you?
It's a conglomeration of African expertise in public health, in infectious disease medicine, and that are also some other professionals that are also in psychology, since these things require psychological counseling and all of that. So it's a group, and just as you said, during the Ebola outbreak, we had a diaspora response task force. It was also a group, and I was the head. And again, the head speaks for the group. Right. So when I speak, I speak for the group. Besides that, I have also made available the resources of my diagnostic company, because you have to commit a particular institution. It's like Pfizer telling you that, hey, I am Liberian, I'm head of Pfizer, I want to produce vaccines for Liberia. I mean, you can't have it any better than that.
Right. Do you have other names, Liberians, that are with you in this group, in this working to bring this COVID relief to our people? Or are you just actually alone?
There are several other Liberians, one of whom just graduated from the Johns Hopkins University. There are several other Liberians who I communicate with, who form a group along with me. Some of them are in various institutions. And like I said, there are other Africans. I'm not sure if you want specific names or you want the process of having the names should not matter, because there are people who organize with you. They don't like this too much, public thing. They want to go on the ground and do what they need to do. And somebody is at the head who needs to organize and make it happen.
Yeah, the reason I ask is you probably, there's exists a Liberia Medical Association here in the United States. There's also a group, I believe you're part of them, the Liberia Medical Mission, that travel to Liberia every now and then. So if you are doing things with a group, that's where I think, because most of the time we go solo, and because you are Dr. Dougbeh Yan wearing various hats, maybe that's where the problem is. Because we are not used in Liberia to have institutions, we do things Even our politics all solo. So that's why I'm very particular about whether you are working with any group.
Right, and this is the question. We have the Liberian Medical Mission, which you know about.
Yeah.
I've been in contact with the head of the mission. I am actively there, but we have the head of the mission. And again, my point of not wanting to call specific names is to protect individuals, given the characteristics of people that we deal with in government. People who find people guilty by association. I hope you understand where I'm coming from. I don't want anybody being guilty by association because I call their name on air and the government is repelling, certain things. Like you say, I wear many hats.
Right.
So let's understand at that level.
Yeah.
Now,
I brought that
so
up.
institutionally, yes, the Liberian Medical Commission, the head and I have been in contact. I had the diaspora task force in the first place, and there are efforts, very, very good efforts underway to begin to engage, other groups like we did during the Ebola outbreak. I was wearing the same hats when we engaged the Liberian government during the Ebola outbreak. I have always worn these hats, so it should not be anything strange.
Right. No, I asked because even during the Ebola, you were criticized for going alone and not having other medical professionals with you, and not having the Liberian Medical Association behind you. So these things have always been there. So I was wondering if these things really got in the way of giving Liberians the help they desire and deserve.
No, and to be specific again, even the Liberia, EULA, and other Liberian organizations were part of that process. If you look at the list of organizations that were part of that process, you have EULA, you have the Liberian Nursing Association, you have the Guinean Response Force, you had several organizations that were under the Liberian Medical, that were under that diaspora task force. So I wouldn't accept that it was me alone. I was not alone, no.
Dr. Yan, given this potential for confusion with your various, medical work for your country, Liberia. Ebola time, there was this group. This COVID time, there's the other group. Do you think it will make sense to have a permanent group that you can work with, that Liberians can get to know that, oh, this is the group Dr. Yan is part of, that is always in this business of carrying on a mission in Liberia? You think it would make sense other than, always having a different group, if I can put it that way?
I am with the Liberia Medical Mission.
Yeah.
I am part of the Liberia Medical and Dental Association in the United States. Whether the Liberia Medical and Dental Association in the United States is even functional, I think that's why you need to investigate first and foremost. Okay. But the Liberia Medical Mission is functional. We have made several mission trips in Liberia. I will give credit to Roberta and Joel Saka for leading our entity. I am not at the head of that entity. I'm not the head of everything. But where specific responsibilities come in, given the medical condition, I take the lead. So I hope you understand that there are ad hoc groups and there are groups that are permanently formed. The Liberia Medical Mission is not an ad hoc group. So when such crises come about, you bring together those little ad hoc groups that are formed around and those existing permanent groups that are around, like EULA, for example, like the Liberian Medical Association and other entities. And that's how we organized the Liberian Diaspora Task Force that time. Similar thing has been underway, but you must have the willingness of the country to accept that. In Liberia, during the Ebola time, there's the same approach we took. I contacted the Liberian government. Mr. Tobo Nuswa was the head of the incident management system that time. We contacted President Salif and we said, we're here. Hey, and everybody was coming up to me and I said, yes, I can help. And we are here. And as soon as they said, we need you, and we immediately brought all the facets and pieces together. Because when these things happen, you find these splinter groups form all around. And the idea is to bring them under one umbrella. So the diaspora task force still exists. This was a process of organizing so that we bring together everybody so that we don't operate on a splinter groups. You will also note that it was through that formation, thanks to many persons who made that happen.
Thank you.
I don't want to, that we were able to testify before Congress as not just Liberia, but I represented the whole West Africa and Africa as a whole, for which the U.S. government listened to us. And today we have the African Centers for Disease Control. We have all the public health institutes around the African continent, like the NPHL, which today is mounting the response. That never existed. All of that came from our efforts.
Right. And Dr. Nyan, we
I
saw that.
Understand from that point.
No, we do. And that's why I'm asking, because we saw how help was pouring in for Liberia during Ebola under President Sirleaf. Tell me, from your experience, what changed? Is it because of President Weah and the CDC government? Why are they not giving you chance now, unlike, because you said you took the same process? What changed in your view?
That's a question for the Liberian government to answer, as I repeatedly said on other platforms, and I said on your platform some times ago.
Can you speculate?
I was critical of the Sirleaf government, just as I'm critical of every government. I am not a friend of any government. From the time I knew myself in science, medicine, activism, I've never been a darling of any government. Why did the President Sirleaf government accept, our overture, and we made that good cooperation that mark? The U.S. Army went in after we made our proposal. I testified. The goodwill from all of the countries, the Western countries, went into West Africa because we're pleading for West Africa. And now we are still pleading not just for West Africa, but for Africa as a whole. That takes me to many other countries. So it is the question for the Liberian government to answer, and not me.
Why not you?
I am not at the receiving end of that question.
Dr. Yan, don't you think
comparatively?
Don't you think this government sees you as an opposition that could be responsible for these poor responses or cold shoulder, if for lack of a better word, that they are giving you?
Then you may have to, if that is it, then you may have to question the approach of this government to its expertise. Do you want expert advice, good advice that has been given will be rejected because you perceive someone as being an opposition?
Dr. Nyan, it's not about perception. You are a member of the NDC and you have openly criticized the government. You supported the June 7th protest. So the government sees you, or you are an opposition. So it's not about perception, don't you think?
If it is a reality, is it wrong for people to speak their mind?
No.
Freedom of press? Is it wrong for people to express themselves, to demonstrate? No. Freedom of movement? No. And these are things that we criticized in the past that got this very government coming in today. So what is different from what happened in the past to what happened today? So you criticize, but when you step into office, then those tenets of democracy don't exist anymore. That becomes the question for this present government.
Right, and we are not implying that it is wrong to do so. But Dr. Yan, you know very well, I follow you from, I was even complimented, has been, someone said, oh, you remind me of Dr. Yan, and that, I consider that a compliment. But the veracity at which you criticize or at which you are vocal was not the same during the days of President Sirleaf. So maybe they are looking at you differently. Under President Sirleaf, you were given the highest honor in the country. So people saw you as being cozy with President Sirleaf, and now you are tough on George Weah, and maybe that's why they are giving you the cold shoulder. Don't you think?
It is quite interesting that you brought that in. As we talk about this pandemic response, in between, due to time limitation, let me continue to first tell our people that the vaccines are safe, they are effective, and they are free. Go and take your vaccines. Secondly, wear your masks, wash your hands, and Keep your social distances. Don't gather in many, big gatherings. If there is a need to cut down parties and funeral rites and all of that in terms of number of people who attend those, you need to do that. Government will have to enforce these regulations. It comes with a question of enforcement. Government will have to design strategies in enforcing these regulations so that it does not turn out to be a heavy hand on an already deprived and hungry population. Now, to come back to your question, we have all been critical of the governments that have held the helm of power in our country. One of the biggest criticism was on the stage when I was invited as orator. If you read my oration, there were, as always, which is not different from what I'm doing now, a critical review of our society, of government's policies, and then advancing suggestions as to how to move our country forward. President Sirleaf said she accepted those criticisms and described my national oration on July 26, 2016 as a very patriotic oration. For the work that I did on the Ebola, during the Ebola crisis for West Africa and for Africa as a whole, which brought into being the Africa CDC that we never had. And I'm not just saying me, there were other people who helped to bring this to being, and I credit them for that, for bringing all of that, for advocating for social justice. Are you listening? For advocating for social justice, for advocating for genuine democracy. You need to read the citation that was read when I was being honored. I was not honored for praises. I was honored for being critical. I was honored for being productive. I was honored for my invention, which according to President Sirleaf, brought pride to Africa. President Kagame and the others also hailed that. I was invited to many other countries along with our fellow African engineers, scientists, and innovators. So how different should that be from what is happening today? I did the same thing. It was accepted. I am doing the same thing. It is left with this present government to either accept or reject. And we are now seeing its reaction.
Thank you. And folks, you are watching Focus on Liberia. I'm Anthony C.A., co-hosting with my partner, Dennis Jai. This broadcast is also being simulcast by True FN 96.1 in Monrovia, Liberia. We have Christopher here, who is doing all the hard work to make sure Liberians in Liberia are hearing from Dr. Nyan on this very important subject. And Dr. Nyan, you continue with your effort. I told you we were going to come to your letters. Your first letter in September went to the Senate, addressed to Abachi, who happened to be the head there, and you were trying to tell the Senate about the efforts you've made and also the Liberian government effort in fighting this pandemic, and you were not happy, you were not satisfied based on your professional expertise that a very poor job was being done. There's something you said in your letter that I will read here because of time. You said in line 6 of the bullet points you included in there, the seeming rush to conclusion by the President Investigative Committee in a 72-hour military tribunal-like summary trial. Look at that language, Dr. Yan, and I'm holding you accountable. Military tribunal-like? We're talking heavier, and you are bringing language of militancy or politics in this. Don't you think it's this kind of language for which these guys see you differently, and then you can't give the help you want to give to your people who really need it? Somebody might think you are the problem here. Don't you think so?
My greatest satisfaction is that I've criticized other governments, not just Liberian government, on the African continent, the Rwandan government, the Ghanaian government very openly. And they accept this criticism, just as you see there. So I think the will of people who have criticized other people yesterday and are in power today not to accept the same criticism is something that we need to question.
And
Something that we need to question.
And exactly, we question that. And
so to that point, we call for an investigation or a hearing of all of the lapses which the government ultimately agreed to. Everything that was critical of the government agreed happened. And we call for a hearing or an investigation. Now, in order to investigate, there is a need to organize a panel of expertise. If that is not done, also, one of the criteria will be to organize the time frame. You cannot investigate a pandemic response in 3 days, of let's just say 72 hours. That is a summary, it's like a summary trial. And that's exactly what happened. To this date, the findings of that particular investigation, which was conducted by the US CDC representative and the WHO representative, have yet to be released. All we saw was the swift removal of Dr. Fala, who was the head of the incident management system, and the head, actually he was not the head of the incident management system anymore since they had removed him, but who was the head of the National Public Health Institute. If we cannot call the spade, or let's say a spade, we will be deceiving our people in Liberia. And this deception has been going on for a very long time. Are you interested in the language, or you are interested in the process and what is happening, the occurrences, the lapses?
And that's why we are here to discuss, Dr. Nyan. We saw how Dr. Fauci dealt with President Trump, who, you saw how he handled things, but Dr. Fauci tried to manage that situation and handle it. Do you really think that you have done everything well to manage this government that is kind of not receptive to what you are trying to do? And we all know your intentions are good. Or do you have some lapses along the way that you yourself look back and say, maybe I should have handled this government differently? Because there's something at stake here. There's a pandemic and our people are dying.
And you are well positioned to help.
Thank you. It's pretty interesting that you're drawing a parallel with Dr. Fauci, one of my mentors at the National Institute of Health, where I was trained as a scientist in infectious diseases. Dr. Fauci works for the government. I don't work for the Liberian government. That's the difference. Besides the point, Dr. Fauci was part of the incident management system, which is the pandemic response in the United States. I'm not a member of the incident management system in Liberia. Dr. Fauci gave periodic statements and very scientific on what was going on. I am not in Liberia, and I have been briefing the country from the professional perspective from my side and my experience in other countries and in the United States. So when you look at that, you will also note that Dr. Fauci was very, very critical of the way he was being treated, just like the way I was being treated by the Liberian government. And somebody put it rightly that the way your mentor has been treated in the United States is the same way you've been treated by the Liberian government. It's just to throw that in. So if you look at the parallel, you will see that Dr. Fauci was in a position in which I am not. I think that has to be taken into consideration. But you will note also that Dr. Fauci came swinging at them as well. And those particular clips, you are journalists. If you go back to those clips, you will see Dr. Fauci swinging at the president. And later on, after these times, you look at his utterances again, you will see that he's been very, very vocal against the Trump government.
All right.
So there was nothing different he did except that he was in a different position. Sorry.
All right.
So that
Yeah, there are people watching or listening to this broadcast from our Truth FM, and we want to send it to Christopher right there. If we have people who want to give us a feedback here, want to call in.
Yes, sure. The text messages are coming, but let me announce the number as usual:
Mhm.
077-5144-278, 077-5144-278. Special interview relayed on Truth FM from Focus on Liberia Television in Atlanta, Georgia. Dr. Chris Nyan, once upon a time, just recently, was a guest on State of the Nation, and Anthony Sie and Dennis Ja are both in the US, and we are here feeding you with the information. So the lines are open, as you just heard, the number 077-5144-278. Just in case I received a call, I will give you a signal, Chief.
Thank you. Thank you so very much. And Dr. Yan, I was just showing the letter you sent to the Senate. It appeared in one of the local dailies there as well. You didn't get the permission to contribute, even with your letter to the Senate, and you won't stop. And we have another letter that you sent to the president. I don't know why you felt that by sending the letter to the president would make any difference. You send this letter also to the president. I just want to show it here, folks. Bear with me. Here's the letter.
So, uh, calls have begun coming in.
Okay, just give her a moment here. So you send a letter. It's dated yet the 7th of April 2021, just this year, and the first letter September of 2020. Nothing happened. And are you thinking that Abacha is different from Josh Weah also?
Again,
Yes,
I
hold on, hold on.
respect. Again, I respect all of the functionaries in our society. And if you can see, as we outlined the steps that I took, the first steps were to write the Ministry of Health and the National Public Health Institute. Is that correct?
Yeah.
The next step was to write the Senate. That is correct. The next step was to write the chief executive when I was already in the region. Let me put it this way. One of the call of some of the officials was that if the man think, he can help, why can't he come here in the country to do what he said he can do? Okay, for any professional or anybody to come in the country, there must be some arrangements. You can just get up from wherever you are to jump in the country. And so at this time, the letter was sent, as you've read.
But that's your country. Why you can't do that?
Mr. C, can we take a break and take our calls, because we're getting signal from Truth FM that the time. So
yeah,
Dr. Yan, give us a minute. Let's hear from our callers in Monrovia.
Yeah, Dr. Yan, let's take a little break. Let the callers wait. We're taking a break, and when we come back, we'll start taking calls.
At Focus on Liberia, we discuss everything Liberia, from education to politics, arts and culture, entertainment, agriculture, history, religion, family, and technology. Focus on Liberia uncovers and showcases the best of Liberia and shows the world the truth about Liberia.
All right, we are back with you, folks. Let's go to Christopher there in Monrovia to take some calls from people or Liberians listening.
Okay, so as I said, 0775144-278. I got this caller coming in, but I had to go. Okay, now we got this one coming in. This caller, good evening.
Hello.
Yes.
This is Matthew calling from Marshall Highway.
Matthew calling from Marshall Highway. Folks, you can hear him clearly?
Yeah, I want to tell you that he still gets comments here very well. He really a good patriotic citizen of Liberia because you're a good advocate. So thank you for him. That you have our praise to go for your analysis. You always give a good analysis when it comes to COVID-19. Thank you for your analysis.
Okay, let me hold you there and take the next caller. Caller, hello. Hello. Unfortunately, you slip off. I'm also receiving calls from the US. I don't know how this is about. So let me try to connect this caller in. When you call, reduce the volume of your receiver and then make your point. Dr. Chris Nyan, a studio guest, being interviewed in the US, relayed on. Okay, let me take this caller. Hello. Hello.
Hello.
Yes.
This is Dr. Kula calling from Atlanta, Georgia, to speak on the issue with Dr. Chris Nyan offering his help to the Liberian government.
Okay, Dr. Kula from Atlanta, Georgia. Let's hear you. The folks are listening.
Yes, I want to thank Dr. Chris Nyan for offering his services to Liberia, and I think it's incumbent upon the government to take him on his offer, because the government is currently asking people like Cummings and others to come on board because of the overwhelming nature of the disease in the country. But I don't think they should use his past political affiliations as a reason not to ask for his help. And I think Dr. Chris Nyan should also reach out to Dr. Kitte and Dr. John and others in Liberia. They need to take this man on his offer. He's one of the greatest scientists that Africa and Liberia has produced. So that's my take on that.
Thank you, Dr. Kula. Thank you so much. The folks he's listening, taking notes, and he could respond to you just after the signal is turned to him. Let me take this call up. Maybe the last call up due to time factor. Hello, Chief.
Yeah, how are you?
I'm good.
This Anthony Zoga for soap in the community. He's been trying by all means to see reason that things will be straight in this country. He also spoke on the contact tracing. He was the one who spoke on the contact tracing that the government should be able to recruit certain amount of people. And we was recruited, massively recruited. But at the end, Jefferson Kochi came out. And then he brought in his own friends and family. He recruited them himself. And he left the whole entire team that he set up, he left it out. So that meant what he's saying is not lie. So for now, this identical replay of COVID-19, we shouldn't overlook it. Let people pay attention to the data. These are people who learn, they know it. They know what will happen. If you don't follow their record, and then you do your own thing, you find yourself in another calamity. So
Okay.
let the government pay attention.
Okay, thank you. So, see, I can get back to you. Maybe we can give additional 6 minutes to respond to these questions as we prepare to take leave of you, because we have another program lineup.
Thank you.
And thank you so very much, Christopher. And let us know as you spare us that 6 minutes. If you get a call, then we'll bring you in. Dennis, we too have some callers here standing by.
Let's Dr. Nyan respond to the callers from Liberia, because Christopher will soon leave. So, Doc, we have 6 minutes.
Yeah, thank you very much. And with all of the questions that you have asked and that I have responded to, the comments from the callers in Liberia, which is representative of the information coming out of there, suggest that my approach and everything that I have done, my offer is on the right track. I am doing everything possible to continue to contribute to the process. It is left with the authorities to open their arms. And it is not just me. Let me put it this way. I represent a whole batch of Liberian professionals who want to come in, and they also, even individually, when they contact, they face the same situation. So I'm only a representation of what is happening to Liberian diaspora expertise, not just in medicine, not just in science, but in other areas of our daily lives. I want to say that we should have this particular process devoid, or the government should have this process devoid of the politics. Because all of the questions you've asked me continue to tilt towards whether because I'm political, or I'm an activist. What is affecting our people? The pandemic is not affecting activists, it's not affecting women, it's not affecting men alone. It's affecting everybody. It is going across the board. And so we need to take the interest of the Liberian people and the people of Africa and the world as primal concern than any individual political interest. And so coming in there, I'm not going to give a political vaccine or a political injection or a political care. Me and others, or I and others, are coming in to give our expertise to everybody, irrespective of your tribe, your ethnic group, your political affiliation, your religion, and your social status. And so the onus is on the government of Liberia, just as you have heard from the callers from Liberia, to respond to this goodwill that is coming from all over the diaspora, that diaspora which I represent.
Thank you. We also want to remind our viewers that you can call in. The number is on the screen. So as to interact and talk to Dr. Nyan, the number is 605-313-6004. The code is 791403. And Doc, we admire your work, but we simply have to do our job to ask the tough questions, because I believe you yourself have made this political, because when you are an opposition figure, and you know you've been in politics longer than I do, and you know African politics, you know politics in Liberia. So if you are on the radio every day writing and criticizing the government, when you even give them gold, they think that that's a firearm. So that's reality, and you know that.
I take it from you, Dennis, and Chris, who just left, and Anthony, and the rest of the journalists who are following. I believe OKFM was also simultaneously transmitting this. They probably might not have been on with you on the app or the technological app. And I want to give all of you my appreciation. The pandemic should not be made political.
You have made it political.
And politicians, I offer an expert help. I did not offer a political help.
You are criticizing the government on one hand and offering help on the other side. So it's very difficult for them to see which hand they want to check.
I am criticizing the process, the scientific process that is in place. And that's what scientists do. That's what doctors do. That's what lawyers do, who want the best of their performance. They criticize the process. So it's not criticizing the government. I think we have to delineate the two. I have not been criticizing the government. I have been critically looking at the process. When they say they want to put an isolation center in a populated area, and I say, no, you cannot do that. That's the process I'm criticizing. It's not the government.
Dr. Yan, I want us to come to the vaccine. Let's leave the political aspect a little bit. Let's come to the vaccine. And Dennis said it very succinctly, the reason why we have to ask the tough questions, because you wear many hats, and that is how the government sees us. So we're just trying to do our job. The main thing here is this vaccine. This vaccine will be able to save so many lives and prevent many people from getting the vaccine. So let's go to the vaccine. So talking about the vaccine, I first of all want to know here, Dr. Yan, what do you know about the government vaccination program? That is my first question. And my second question is, how will you compare whatever vaccination program that we got going on in Liberia or to other countries in the sub-region?
First and foremost, this is where the critical reviews come in, and it is not taken lightly. Mm-hmm. And as scientists and doctors, medical doctors, both hats which I wear, mm-hmm. we subscribe to ethics. We subscribe to standards. Mm-hmm. And this ethical standard procedure must be followed. Up to present time, one of the ethical responsibility of a pandemic response, which we call public health transparency, is lacking. One, we have not been able to get hold of the government's own data, the diagnostic data, how many people have been diagnosed in that country so far, the procedures that have been carried out in diagnosis is all like kept, secluded, discreet. The second thing is we've requested the government, and then when I say government, I mean the National Public Health Institute and the Ministry of Health, through our intermediaries, to provide the rollout program. We've not been able to get that. We've got a shot of that some times ago. And the way it's been rolled out, and as was said, needs to be revived. Number one, there was not an active awareness program on there was not an active awareness that was carried out. Not that I know of until when I got there. Secondly, the tier of how the vaccination will be administered does not speak well when you compare it to other countries. It was said that government officials, particularly in the legislature and other places, will be the first to get the vaccines. I'm just starting from that point. Mm-hmm. But when you look at other countries and what we have done in the US and in other countries, it is health workers and older people and people with underlying conditions meaning people with heart diseases, diabetes, and immunocompromised, people with HIV/AIDS and other diseases, other immune-compromised diseases. They are the first to get it. You want the health workers to get it first because they are going to be protected to go into the community and they have been the frontliners. Mm-hmm. And you want those older age people because they have been the one dying a lot because of underlying condition, because of age, to also get it. But when you compare that with the Liberian rollout, where they want government officials in the legislature to first get it, it says something that is not appropriate. There has been not much justifications given for that. Equally so, we have said first line to get it will be the highest government officials, like the president, the vice president, people in the like the legislature, president pro tem. You want that representation of government to get it, to take the vaccine. That way it gives confidence to the rest of the population. You saw that in the United States when Biden took it, Kamala Harris took it. You saw that in Rwanda when Paul Kagame and his wife took it. You saw that in Ghana when Akufo-Addo sat and showed his arm to take the vaccine. So when you look at that, these have been just the initial problems that we've seen with the rollout. Number one, lack of awareness. Number two, lack of a proper rollout. And do they also have the technical expertise to guide it? That also is a question. So these are things that we want to discuss on a collegial basis. And that is why when they didn't, respond to my last communication, I went into the country. At least they said, why the man can come. I went there now. I was there and I said, I'm here. Here I am. Nobody came. And I started carrying out what I needed to carry out. Number one, the awareness over the radios, through television, and going into the communities. So I went into Bassa community, Dupo Road in Peaceville, and several other communities which I can't readily name now. Right. So that's that. I just a short answer to that. I hope it was not too long, but it was needed to give you a summary comprehension of what is going on.
And definitely we appreciate that. And for a government that is not open to the kind of help that you wish to give, and we are all concerned because the new variant in Liberia, that's scary. It really that is there, and that's killing people. We've seen 2 minute rest in peace on social media, and we're thinking this could be COVID. Even in my hometown, as far in the southeast, there were 3 deaths, and they are beating people because they are witchcraft. I'm saying, could this be COVID? So how do we work around this government to kind of give the kind of help that we want? Can you maybe develop a plan, even if they don't want it, you put it on the internet so that health workers, or how do you intend to work directly with physicians, with health workers in Liberia to work around this thing? Because we can throw up our hands and say, oh, the government doesn't want it, and so end of story. What do you do?
Writing stuff, putting it on the internet, procedures is not the appropriate.
I'm just saying.
I know it's just a suggestion, expert way to go about it. And then, like I suggested, There can be the collegial exchange if the side of the government is open. For example, when we were discussing the question of the variants, and some of those students, medical students, public health students, and public health practitioners that were there, it was a major concern when I made those predictions that we will be getting a spike in this country and we shouldn't look anywhere else. We held this meeting at the Youth and Sports Complex, and the announcement was given all around. Why do you think that not one government official, and to be specific, the Deputy Minister for Health, who was the Chief Medical Officer, received all this communication and knew that I was there? So there's not much you can do if the people who need this kind of help or need to cooperate with you are not coming forth. What we are trying to do now is to see whatever can be done from the side of the diaspora, and there are efforts on the way. But again, like the way President Salif and her government were open to us, will this government be open to that kind of effort? So you can put together something, which at the end of the day, you don't know will be received.
All right, Dr. Yan, we have a lot of people who have questions for you, but my final question here, I believe there's a lot of goodwill out there for getting this vaccine for our people. And during the Ebola time, you contributed immensely at the level of Congress, and this goodwill pull in, then they talk about it. How can we as a people or the government tap into the goodwill out there to get as many vaccines as possible for our people?
Currently, the way the vaccine is being distributed is such that for our types of countries which are listed as the low to middle income countries, quote unquote, poor or developing countries, there is this organization called Gavi, which is the Vaccine Alliance. They pool resources from rich governments like the US and European governments, and from philanthropists, and then buy a lot of vaccines and have them in a pool and distribute these vaccines to various countries, and they give each country a quota. Now, that's the official way the vaccines are being acquired at the moment, because all of the vaccines that have been approved under emergency use authorization. So they are not really giving it to individual commercial entities to distribute or to source. In Africa, the vaccines have been sourced mainly by the Africa Union or medical arm, which is the Africa CDC, which arose out of that testimony in Congress. And so the Africa CDC gets all these vaccines and then distribute them to the various countries, given the quota those countries have. Liberia had a quota of about 200, and the last data that I saw, because those data are updated periodically, Liberia has a quota of about 230,000 to about 300,000. The first about 76 to 96,000 doses were sent in, and these quota will be met by Gavi sending in the doses incrementally, because you have to exhaust the first one they send just at the time that you are exhausting it, then they push another set to you. I doubt, again, we were talking about public health transparency, how much of this have been administered. If you look in the United States and other countries, they tell you how many people have received first dose, for example, right? We all know that. But if you ask our government, they don't tell you this thing. So even as professionals, if we don't know, how do we advise?
Right.
So that is the bottleneck we continue to face. That's the stage of the vaccination process in Liberia presently. We don't know how many doses have been given, and the vaccine is AstraZeneca. It needs to be given as a 2-dose regimen. They have given several persons one doses. This next year, are those people coming back to get their second doses, or are they still on their first doses? Administering first doses. These are information we need through public health transparency. It's not a secret, so they shouldn't take this information as secret.
You're correct. And before we bring in our colors, here in the US, they have CDC approved vaccine. How can we be sure, or how can you advise that which vaccine is approved, or what our people taking in Liberia, for instance, is safe? The efficacy, the safety, and everything has met our standards. How do we know that, and what can you advise about that?
the good thing is that their sons and daughters are out here in the communities, the medical scientific community. You remember during the Ebola time, we were on the vaccine studies. Dr. Lisa Cooper, and again, you see, I'd say I didn't want to give names on the efforts that are all around here. Dr. Lisa Cooper and myself were on the vaccine monitoring, data safety monitoring board of the Ebola vaccine. So we follow these things. We have the expertise here. We get the data. We analyze it just as the people are analyzing it as well. We know that the Pfizer vaccine has been proven to be safe and effective. It's about 95% effective and is safe. We know that the Moderna vaccine is also about 92% safe and effective. AstraZeneca is about 83%. Johnson & Johnson have 3 different efficacy, but as a median, it's about 76 to 78% effective. And we have the Sputnik 5 from the Soviet Union. Then we have another one we just came out from Cuba, which is 92% effective. Imagine, Cuba have produced a vaccine and they're willing to source that out to poorer countries. This is how we know from the data that these vaccines are effective. We follow it scientifically. The studies data is evidence-based. The second thing is the vaccines have their own side effects. Like any other vaccine, when it is administered, generally those who receiving the vaccine may have slight temperature, which we call subfebrile condition, or they may have high temperature for that matter. You will have sore on your injection site where the injection is given. And for the AstraZeneca, for example, in Europe, it has been revealed from our colleagues that it did produce some blood clot in a sector, just a few persons, which is a rare side effect. And they are still starting to see whether it is associated with the vaccine or is associated with another condition altogether.
Thank you.
But they have given almost like 25 to 50 million doses of that vaccine already. When they saw about in the United States and other places, they saw about 20 persons. In the United States, that was Johnson & Johnson, which also had the same side effect. So after giving about 50, to 100 million of those doses and only 20 persons, that's statistically insignificant. It may be it may be an outlier. It may be something else altogether. So we have explained this to the population, and that's the question of the side effects and other things, and those can be treated.
Thank you. At this time, we will open the phone lines for callers. Mr. Sia, if you have some callers on the line, let's bring them in to interact with Dr. Nyan.
Evangeline Mamintai, go ahead. Oh, let me see. Evangeline, are you there?
How are you?
I'm fine.
Yeah,
go
I'm
ahead.
Mm-hmm. How are you, sir? I just want to first of all, say thank you to the doctor, and I want you to stand your ground, sir. I'm in the medical field too, and I know exactly what you're talking about. And the question coming to you here, I think our people trying to play mind game with you, knowing very well how dysfunctional our government is in Liberia. It sounds like the white man country where things are in order. This government is out of whatever word I can use here. So before you take this shot, I just took my shot, the last one on Saturday. All my arm was swollen. I was shaving, cold, chronic underneath the blanket. I was taking the first one. When I took it, I took Tylenol, activated the fever more. I didn't know that I was supposed to take Advil. All those things have to be brought to you. The people have to have a record. Those who took the shot first, even when you go take the shot at Walgreens, they ask you, have you taken any shot before? All these things they have to know it. But you just want to throw the man because we're desperate. Yeah, go and do a work. First of all, you're not the one that pays his school fee. You still got his loan that you have to pay for. It's not free. Even if you want to help, you have to know everything other. So thank you very much, doctor, for standing your ground. And please do not cape to them. before you put yourself license in jeopardy. Thank you.
All right, let's take another one. Dr. Yan will take a couple of them, and then we will have you to respond. Let's bring in caller with phone number ending in 6084. Your name and where you're joining us from. Caller, are you there? That caller might not be paying attention. Let me bring in the man, Jimmy Eastman. Jimmy? Jimmy Eastman? Jimmy? Jimmy is not hearing us well. I don't know what's going on. Dr. Yan, you might respond to that caller, please. The other caller seems not to be ready.
Yeah, well, I think it's the validation of everything that I have been saying, all of the stumbling blocks and roadblocks that I have hit in trying to mobilize the resources out here, human and material resources to go in, which have not been received well by the government back home. Again, I want to say thank you to that caller. I will continue to do the best I can, along with other colleagues here who have experience, in mounting public health pandemic response, like the very top news what you talk about. Like I said, I don't want people finding people guilty by association. So I associate with everyone on a professional basis, including Dr. Kete, Dr. Fala, and all of these colleagues of ours. So we will continue to do what we can. Those who are in authority in the country should be the one to, at the end of the day, open their hearts, open their arms, and find reason to invite the kind of help that they need. Fortunately, I was trained in a social democratic country, and I did social medicine. So it's my responsibility to always give back. I don't have student loans to pay at the moment, so thank God for that.
All right, Dr. Yan, do you think this government has money to buy vaccines for its citizens? Are the vaccines available for sale for governments around the world to buy? And another question is, how should we get a vaccine, best vaccinate Liberia from this killer virus?
From the look of things, I would think that the government has the money to buy vaccines. Why do I say this? Somebody may say, well, you are not in the government, you don't know. We see the budget. The budget has been made public, and we see how finances are moved here and there. So take, for instance, when the government sourced $30 million from the World Food Program, feeding program, which I also said at the time, which become, again, from a professional standpoint, but it's taken politically. I said the $30 million, $10 million of that can be used to invest in one of the vaccine producing companies, like Pfizer, Moderna, AstraZeneca, so that when the vaccines are made, are produced, we can have vaccines coming into the country that we don't have to worry about in terms of buying. We would have already invested some money in those companies. Then if even we want to say, AstraZeneca or Pfizer, your vaccine is this amount, can you give it to us for half the price? We will have the bargaining power because we have invested in that. That suggestion was ignored. So today we see that the whole World Food Program situation has been questioned. The money, according to the reports that came out officially, when the money was mismanaged, the feeding program was mismanaged. So imagine if we had taken the whole $30 million, all right, that we sourced to buy vaccines. We are just how many people? Let's just put it at 5 million. We are 5 million. $30 million would have done, and I'm even saying 30 million. $10 million, $25 million would have done a lot. So yes, we do have the money, given what has happened, but how the money is being appropriated is the question. The second thing that has come to the fore in recent times is when you look in the Liberian budget, which has been recast, there is this $15,000 per head in the Liberian legislature.
Dr. Yan is 30. They just got the first one. So let's say 30. The 30 is in there.
it's 30. Now,
Yeah. Mm-hmm.
let us deal with the 15 that we know. Just the 15.
We know about the 30.
The $15 million, 15,000 each, all add up to about 3.5 to $4 million. If you took that amount now and go to Johnson & Johnson vaccine is only one shot. So we don't have to worry about us giving people one shot and then we have to go back to find out whether they will come back for their second shot. So Johnson & Johnson has a philanthropic, model of their business. So they will be willing. So if we took that $4 million and say Johnson & Johnson give us vaccine for $1 a dose, Johnson & Johnson, I believe, will be willing to do that. So governments can go and buy, governments can source, but our governments only depend on sourcing free things.
I know. All right, and now you are giving free help and they say no. So I don't know if they even believe that.
That's what we are.
But let's bring in a caller. Caller, your name and where you calling from?
Hi, my name is Marcus Young. I'm calling from Virginia.
Roger, go ahead. Comments or question?
Yeah, I want to say thanks to the guest in studio, Dr. Yan. Sometimes the information some people put out there about this vaccine, it just make our people, afraid of the vaccine. Right. Me talking to you currently, I've taken my first and second dose of the Pfizer vaccine. And even when I took the first one and then the second one, this side effect, it doesn't affect everybody. That's why I always tell people, the side effect doesn't affect everybody. Every human being have different system. When I took my vaccine, I didn't have any side effect. The Pfizer vaccine. Yeah. I didn't have any side effect. So basically, a lady called recently, and then she said she was shivering and cold. Even when my mom took the vaccine, her second shot, she had the same strong fever. Her temperature went so high. I think we went with bought, I think, OTC, certain drugs that they prescribed.
Over the counter.
Yes. So we went on the counter, and then I told the physician, and then she gave me some medicine, and we gave it to my mom. She was okay after a couple of times, like in the morning time, she was okay. She even went to work. So I just called to tell our Liberian people that the vaccine is very safe, and the side effect, it doesn't affect everybody. It just depends on the kind of system you as a human being, and in particular have, or individually,
Thank you.
That's the only message I get from my people out there.
Thank you, brother. Thank you. And let's take a few comments, and Dr. Yan, you can respond. This one from Jimmy Eastbourne. Authorities in Liberia have a way of turning away help from Liberian experts and professionals. This is a trend everywhere. Liz Momba Jala, she lives right here in Metro Atlanta. This government has no intellectual knowledge, therefore they are not aware of anything. Armstrong Jabba, the guy who is planting rice in Liberia and other food stuff, he said, I sent the government a detailed proposal of how to grow and store food in our populated counties, just in case there is an outbreak for our people to have food. But up to now, no response. So our people are calling on the government, and what we're getting is no response. Dr. Baton Kula, the CDC government should get Dr. Dougbeh, Chris Yan, and others on the front line. He continues, Dr. Dougbeh, Chris Yan, are you in touch with Dr. Carter and Dr. Jala? Dada Logan, how in the world we have a top scientist in Liberia and he is not even spreading the whole virus prevention, protection, and protocol in the country? He is shocked, Dr. Yan, that you are not involved. Telfor Amos, Dr. Amos, a presidential hopeful, writes, my people perish for the lack of knowledge. We need a new beginning of dialogue with experts in the diaspora. Doctor offer help gets trampled upon. Power doesn't mean knowing everything. What power represents is the ability to gather those with various expertise, empower them to yield results that will benefit the citizenry. Let's wake up, Liberia. Agatha Allison, dog, is because you are a Liberian. If you were a white man, they would have taken you seriously. Shaking my head, man. And there are some.
And this one said, a medical doctor has the right to critique a criminal and roguish government.
And Robert Helmer thought one of our questions was a stupid question. Keep your criticism coming. We love that. Dr. Kula said, focus on Liberia. Why don't you ask for a copy of the letter? We have a copy of that letter, Dr. Kula. Secondly, why don't you realize that they are now asking Cummings and others to help? This man is a well-known infectious disease clinical researcher. Robert Helmer said, if foreigners were involved, the government would support. Let's see, there were some few questions here, very critical. Eventually, Mamita said, unlike other so-called talk show hosts, I like how Mr. Ansoni Sia is not biased with his question. Thank you, sir. Anthony Zoka, the government lied to us about the contact tracing. We were recruited and trained to do the work, but the city mayor brought his close friends and family to do the work. Dr. Yan, those are a few of our comments.
And Dr. Yan, before you comment, this one from Jean S. Keller, this man is his own problem. Instead of focus on his job or project, he decided to be political. Man say, you're your own problem.
Well, I think we addressed that lengthily already, so we don't need to go into that. And other comments that were made also tilt towards validating the discussions that I have just had with you, and statements that I made, where, like I said, it's not just medical doctors. It's not just on this infectious disease thing. The comment from this young man, Armstrong Jagba, I believe I have seen and really applauded his efforts in Liberia in the area of agriculture. He's been showing a very good model of agriculture in the country when we talk about food self-sufficiency. And as you well know, he proposed and nobody picked that up. So he's not, I don't know his leanings, but I don't think he did anything political. I don't think he criticized the government, yet there has been no response. And I believe he has sent that proposal in long time ago. So with the questions you were asking me, and like I said, two of you are some of the tough interviewers I've come across in recent times, very fair, and I take every shot. You will see that everything that I have said here has been validated by, your callers and the comments that have come in. My only hope is that our people will continue to follow the healthcare regulations that they can follow without government pressing them, wearing your masks, or washing your hands, using those sanitizers that we had in those little bottles that you buy from Waterside and wherever. Keep those on you and keep sanitizing your hands. Keep distances from people. If you don't have to go to a Radisson market or Red Light market, you don't need to. You don't have to take 3-4 of your friends or your family members to go there, so that you can reduce the number of traffic, that human traffic that will be going into the market. You can do, look, there are a lot of things that can be done, but like I said, it requires the collegial and expertise discussion with our colleagues in order to have these implementation strategies laid out and implemented and carried out.
Thank you. A few more comments here.
Sorry, Dennis.
Eventually say, even if you were criticizing the government, so what? John Conway say, come on, Mr. Dennis Jai, you are way better than that. Don't stoop to the low level of the CDC kakistocrats mindset, suggesting Dr. Yang has politicized his work. Martin Brown, Dennis, what's about Cummings that has been criticizing the government and extended existence, and President Weah embraced? Just yesterday, President Weah called on all Liberians to contribute or assist in whatever way. So why not Dr. Nyan?
And this one, then is from Julius T. Jason the second. Thank you, our award-winning infectious disease scientists. Your love and support for Liberia remains matchless. We can only wish that with more of your kind in Liberia. Keep up your good work for the motherland. With people like you standing on the side of the struggling humanity, we are reassured that a better Liberia is possible.
The last comment here, Errol Password said the government has thin skin. They need to grow up and be able to govern. And Dr. Young, do you think the government has thin skin and is not able to tolerate political opposition, even if they are giving help?
Well, the government that is currently in our political arrangement was in the opposition yesterday and for 12 years plus. It was one of the heavily criticizing instruments against the past government. It should kindly allow itself to accept criticism and learn from those criticisms. That's the only way you can govern well and become better in your governance system. It is better that you receive critical review from the outside than dancing to the praises and sycophants in the inside. It does not help. So I would say that much in advising the present government. A caller just said that an opposition politician offered, again, I put opposition in quotes most time because I don't like that word opposition. Opposition politician said that he giving help to the Liberian government and is accepted. So if politicians can begin now to give help to, can begin now to offer help, let's put it that way, and it has been welcome. We hope that our expertise offer help, which is already offered, that it can be welcome. The letter is there. The government knows about it. Minister McGill knows about it. Just a minute, please.
Ladies and gentlemen, if you are just joining us, this is Focus on Liberia. We are in an exclusive interview with Dr. Dougbeh Nyan. He's an infectious disease doctor, and he's been offering help to assist our country with COVID-19. But according to what he's saying here, the government does not seem to be interested, and that's why he's here. Dr. Nyan.
Yeah, and so we should not begin to use the pandemic and all these political people should not begin to use this pandemic as a political carrot. The interest of our people should be prime and foremost. Epidemic and pandemic response, disease infection that takes over a community is not something to joke around with and play politics around. What we need is, and I would say what we need are the requisite expertise to be mobilized, to go in. The necessary roadmap in addressing this pandemic needs to be organized. We need to have a collective patriotic approach to this, and not, the political carrot, stick and carrot kind of approach that we are now seeing. And so in the past, for example, you will see politicians giving buckets, making donations here and there during campaign time, making donation of bag of rice. Today, we're not seeing that. This is the time that it should now be done. So that kind of practical, I'm not saying you should go and now begin to gather rice and other things, but because people will be hungry, people will be locked down, people will be locked in, whether they are self-locked in or it is proposed by the government, they will need to be fed. The government itself can arrange that. But I think this is where now very important entities can come in. But what we need to see here is a collective patriotic approach and not utilizing the suffering of the Liberian people for a political game.
Right. My father once told me that if you're taking crab from a tower, you need to be very careful, else you break the pulse. Our country is suffering because of the pandemic, and you have the knowledge, you have the expertise. I want to see a plan on what else you can do. How can you get this crab from this tower without breaking any pulse so that our people get the help they need? Because it comes back to you, right? Because you didn't just study medicine, you also have some management skills, organizational skills, people skills, communication skills. How do you work around this thing to take down the Bukuman so that our people get the help they need?
One of the good things is that the countries that we have gone in have been open. The same criticisms that we are giving here are criticisms that we give those countries, and they were open.
I know that. But for Liberia, what will you do?
Right, and we've seen the good results from there. Why? Because they were open to receive. We can put together anything we want to put together here in the diaspora or elsewhere. It has to be received.
Sorry to interrupt. I'm saying because they are not opening up, is it the end of story, or how do you work around it? That's where I'm going with it.
Oh no! As an example, when I went in the country recently and was waiting for the government to respond, they didn't respond. I got to work, right? I went on the radio stations and started first and foremost the awareness campaign, explaining to the people what the vaccination is, addressing all of their questions. Went into the communities along with a nice little team of science students and public health practitioners. We formed a team and went into the communities. We did that. So going forward, we will be putting together efforts, and hopefully that can be translated into the same actions where we will not need government's authorization to do what we need to do. So those are mechanisms that are currently being worked out, some of which I cannot really speak on because they are in their infancy. And there's a lot of goodwill out there, to say it frankly.
Thank you.
Dr. Nyan, you communicated with the government sufficiently, given the evidence we have in our possession. Communication starting with Ministry of Health, the Senate, the President, and maybe others you have engaged with, outside of the public realm and all that. Here we are. The government is still giving you cold shoulder. If the government changes its mind and say, "Oh, Dr. Nyan, we didn't know what we were thinking. Can you come?" Will you be ready?
I'm presently with the Maryland Medical Reserve Response Corps, Medical Response Corps. When I left, I went on international duties. Since I left from Maryland, I went to the West, went to Africa, and I'm back, and I've been resuming my duties and, waiting for assignment and other things. Whenever the government of Liberia wants us to come in, we are always prepared to step in under the arrangements that will be made with the government. And so we are ready, we are open. There are a lot of other Liberian medical professionals that are also ready, but when they see what's happening, they question me, and I have to give them, explanation. So yes, there is a goodwill. There are a lot of professionals in the medical, epidemiological, and public health area that are ready to go in. It's left with the government to give us that go ahead or to request that help, because we cannot just go in. I gave you an example with the Liberia Medical Mission, for example. We've always made mission trips. This Liberia Medical Mission has gone in. We carried medications, we carried equipment, and you wouldn't believe how long it takes to even free the medication that are needed to go into the communities in the various hospitals in order to carry out free surgical procedures, treat people. We go in, the LMM goes in with well-trained doctors to carry out these activities. So that's where we are.
Thank you. And let's say, I don't think you need government approval. Let's say if someone donated 22 million doses of COVID vaccine for us to ship it. or let's say the people in Nuku Town want you at Redemption Hospital to help, or to see how we can avoid West Point having an outbreak. If people like that call you, will you go, or it have to be the government?
You see, the scenarios that you are given are outside of people's zones. Let's put it that way, because the people of Nuku Town, the people of Soniwen, the people of Duporo, Pinsville, of Bassa community did not call me when I went there. So it doesn't necessarily have to come from them. I know I'm trying to figure out what you mean, and I know exactly what you say. But it doesn't have to be at that rudimentary level, because they are not going to provide you with the situation they are in, with the requisite tools and little mobility equipment that you need. Everything is self-supported. We know that. But under this pandemic situation, where the government has the resources to do that, the government should really step in. And we think it should be a state responsibility. It shouldn't be an extra responsibility of the citizens again to do that. We should, and you and I and other people, we always talk about institutionalization of our functions. So, like I said, I sit before you and come on your show to explain these things, not just as Dougbeh Nyan, but like I said, I represent, an array of all of these professionals who are interested in going in. But so it's really institutional, and we have to take it from that stance. We don't want to circumvent things around just individuals.
Dr. Yan, I listened to you. I tried to follow your work of recent since I hired you for the first time. I'm not trying to blow your horn. This is not what I do. But to your credit, you are a scientist known in the world. You happen to come from a country, Liberia. You're making all the effort to help. You wanted to help produce a testing kit, something that another country in West Africa, Senegal, did produce for its people. You wanted to see that happen. Your efforts being stifled by your own government. How does that make you to feel sometimes?
Well, I'm concerned about the health of our people. Because if that effort is stopped, we know what the consequences are. That is why today we see a lot of infected, COVID-infected, supposedly COVID-infected persons passing through the cracks at the airport. We don't have a rapid diagnostic test. If they have it now, not that I know of, because I just came from there about 3 weeks ago. You go at the airport, there's no diagnostic, rapid diagnostic test. Only your sample is taken and then sent to the lab for the next 3 days. I didn't receive my results when I took the test at the airport. So what I'm saying is—
Did you pay your $75?
Yes, I did pay. I had to pay for it. I paid for it. I paid for the test. And
did you get your money's worth?
I would say no. For that purpose, no. I did not get my money's worth.
Because what would be the recourse here? Because I'm thinking, I really get it that there's been a roadblock, and I'm not trying to be pessimistic here, but I don't think the government is going to have a change of mind. So what is the recourse? Is it that we go through political parties to demonstrate? Is it, and I'm going to give some extreme ones here. I'm only trying to think out loud. Can we go through political parties to do a go slow action? Can we go to the Senate? Can we go to the ECOWAS court to say, hey, something is coming, we're trying to help the government? What else can you do? Or what else can you tell Liberians to do so that we can make this help, so that our people get the help they need? That's where I'm going to focus now.
Well, in that light, I would think we should continue to advocate for the government to see reasons to allow the help that it needs to come into the country, particularly from its own expertise that it has, so that it does not depend on expatriates all of the time. We are talking about self-sufficiency. And these are governments which pride themselves ran on this platform of, making Liberia better, making Liberia number one. Liberia is all we have. If making Liberia number one and Liberia is all we have, Why is it that we are refusing to give to Liberia what belongs to Liberia, people like ourselves, to put in the effort in order to make Liberia better? So these are the kind of questions that we need to answer. So we need to really advocate more, you know, in the most appropriate democratic way to inform the government, to impress on the government the need to have a change of mind, that the government is hurting itself. Because if the people are sick, like the way we have this pandemic now, and the people are dying, it falls back on the government.
Yeah.
It doesn't fall on the individual doctors. It's what the government is doing. Why is it that the government is not doing this? Then it falls on the president himself. Mind you, it does not fall on the minister. So the president becomes responsible, although there is the minister of health or the minister of this, the minister of that, who's supposed to be responsible for certain actions. So you see, we have to take this advocacy at these various levels.
True. Thank you so much. Thank you. Go ahead, Mr. Sia. We need to conclude now.
And Dennis, that's what I was coming to. Dr. Nyan, I think we have exhausted the questions we have for you. I want to say thank you for making yourself available for almost 2 hours now, taking our questions. I have your phone number. That's the trouble you're in. I will call you again. We need to continue the advocacy. That's what you just said. So we are helpless right now because, hey, can we do this for our country? And the government said, no, you're not going to do it because I don't like you. So let our people suffer, and that's what it is. So let's get your closing statement. We can also reach out to you, as I said earlier, to do this again.
And in your closing, please speak directly to President Weah, if you can.
Well, I just want to thank you again for the invitation, and to thank Truth FM, OKFM, and all of the other radio stations on which I have appeared in order to carry out these awareness exercises that have caused, you know, a lead, at least to be taken in the vaccination process. We need to vaccinate the world. In vaccinating the world, we need to vaccinate our countries, our communities. That's where it starts from. Once we can do that, we are going to break the transmission chain. And so I will ask our government, and I spoke through your media or some other media again, directly to the president sometimes ago through your media, if he's listening, if some of his lieutenants are listening, we are not harmful. All our lives, we have sacrificed it for Liberia and for Africa and for humanity. Nothing you can see that we have done that has harmed our country. In our professional careers, we will continue to be critical to bring those good things forward so that it helps our countries and our continent. Open the doors to accepting the help that has been proposed. There are a lot of Liberian expertise out here that are experienced in pandemic response in the United States and in other countries, including myself. We have been discussing and we have been formulating strategies as to how to intervene. When the time comes, we hope that the government will open its arms. We hope that the government can now start reaching out as of this point to pose the very questions you are posing. Dr. Nyan, Dr. Cooper, Madam Stone, Nyoswa, I mean, you name all of them that you can name. What can you do to help this situation with your experiences? This is what I think the Liberian government need to start doing. While we are beginning on the one hand, they should start approaching on the other hand, and we can all meet halfway so that we can save our country, we can save our region, we can save Africa and the world. We are doing this in other countries. We can do it for our own country, but our countries need to be open.
Thank you. It takes two hands to clap, so so the other hand needs to be there. Tonight at 6 p.m., we're going to have the literary hour. Please tune in. The topic, the making of the Republic, the second Exodus. And this is being hosted by Dr. K. Moses Namwe and Jackie Sayer. Please don't forget to tune in. Dr. Nyan, we want to thank you so much. We want to thank all our viewers for watching. At this time, on behalf of all of us here at Focus on Liberia, I want to say thank you so much for watching. We never close our broadcast by playing the song that says, "We are all Liberians." The pandemic is there, and we have different opinions in how to approach it, but that does not stop us from being Liberians. And it is incumbent upon us to do whatever it takes to make our country that glorious land of liberty. Have a good day.
We are Liberians.